Imagine waking up on what feels like a perfectly ordinary Tuesday. You make your coffee, answer a few emails, drive to work. Maybe you notice a mild headache or feel a little more tired than usual. Nothing alarming. Nothing that would make you cancel your plans. But what if, during that seemingly normal day, your heart and blood vessels were already under more strain than you realized? Here's something that surprises many people. High blood pressure is often called the silent condition because it frequently causes no obvious symptoms at all. According to the Centers for Disease Control and Prevention, nearly half of adults in the United States have high blood pressure, yet many don't know they have it. And for women, the story can be even more complex. Hormonal changes, pregnancy history, menopause, aging, and even symptoms that seem unrelated can all influence cardiovascular health in unique ways. So how do you recognize when your body might be asking for attention? That's exactly what we're exploring today. Hi, I'm Kristen. For more than 12 years, I've focused on researching women's health, reviewing scientific studies, and translating complex medical research into clear, evidence-based information that's easier to understand. My goal isn't to diagnose or replace your healthcare provider. It's to help you better understand how your body works, what current research tells us, and which signs are worth discussing with a qualified healthcare professional. Because knowledge is one of the most powerful tools we have for protecting our health. In this documentary, we'll separate myths from facts about high blood pressure symptoms in women. We'll explore why this condition is often called silent, why certain warning signs are commonly overlooked, and how the female body experiences cardiovascular changes throughout different stages of life. Some of what you'll hear today may surprise you, and one commonly ignored symptom we'll discuss later is so often mistaken for normal aging that many women never connect it to their heart health. Let's begin with a story. Meet Susan. She's 56. She works part-time, helps care for her elderly mother, and spends weekends chasing after two energetic grandchildren. Like many women, she's always taking care of everyone else first. Over the past year, she's noticed little changes. Some afternoons she feels unusually tired. Occasionally, she wakes up with a dull headache. Every now and then, she experiences brief moments where she feels flushed or slightly lightheaded after climbing the stairs. She laughs it off. I'm getting older. Her friends say the same thing. Maybe it's menopause. Maybe it's stress. Maybe she just needs a vacation. So life goes on. Months pass. Then, during a routine health screening at a community wellness event, the nurse checks her blood pressure. The numbers are higher than expected. Susan is shocked. She hadn't felt seriously sick. She hadn't experienced dramatic warning signs. She certainly didn't think anything was wrong with her heart. Stories like Susan's happen every day, not because women ignore their health intentionally, but because many subtle changes are easy to explain away. And here's an important point. High blood pressure itself often develops quietly over many years. Many people experience no symptoms whatsoever. When symptoms do occur, they can overlap with everyday experiences like stress, poor sleep, dehydration, menopause, or simply a busy life. That's why routine blood pressure checks remain one of the most valuable tools for understanding cardiovascular health. But researchers have also learned something important. Women's cardiovascular symptoms don't always follow the patterns people expect, and that's changing the conversation. Before we talk about possible symptoms, let's understand what's happening inside the body. Imagine your circulatory system as an enormous network of highways. Your heart is the central pump. Your arteries are the roads carrying oxygen-rich blood to every organ. Your brain, your kidneys, your eyes, your muscles. Every single cell depends on this constant delivery. Now imagine traffic moving through those highways. A healthy amount of pressure keeps everything flowing smoothly. But if that pressure remains consistently higher than normal over time, those delicate blood vessels experience extra strain. It's a bit like water flowing through a garden hose. A little pressure is necessary. Too much pressure, sustained day after day, gradually wears down the hose. Our arteries respond in similar ways. Over many years, consistently elevated blood pressure can contribute to changes in blood vessels and increase the risk of cardiovascular disease, stroke, kidney disease, and other health conditions. According to the National Institutes of Health and the American Heart Association, this process often develops gradually rather than overnight. That's one reason regular monitoring is so important. Here's something many people don't realize. The body is remarkably good at adapting. Even while blood pressure remains elevated, the body often compensates well enough that a person feels completely normal. That's why relying only on symptoms can sometimes be misleading. Yet there are certain experiences that deserve attention, not because they automatically mean high blood pressure, but because they can be part of a much bigger picture. Let's explore the first one. Number 1, headaches that shouldn't be ignored. Headaches are incredibly common. Most are caused by completely different factors: stress, dehydration, lack of sleep, eye strain, skipping meals. But here's where things become interesting. Many people believe headaches are always a sign of high blood pressure. The truth is more nuanced. Researchers have found that most people with mildly or moderately elevated blood pressure do not experience headaches because of it. However, in situations where blood pressure becomes extremely elevated, a medical emergency that requires immediate evaluation, a severe headache may occur along with other serious symptoms. This distinction is important. So why do headaches appear on nearly every list about blood pressure? Because headaches are common and people naturally connect them with whatever health concern they're thinking about. Clinical evidence suggests the relationship is far more complicated. Imagine Linda. She notices she's been waking up with headaches several mornings each week. She assumes it's her pillow. Then she blames allergies. Then stress. Maybe she's right. Maybe she's not. The headache alone doesn't reveal the answer, but combined with routine health checks and conversations with her healthcare provider, it becomes one piece of a larger puzzle. This is an important lesson in women's health. Rarely does one symptom tell the whole story. Healthcare professionals often look for patterns rather than isolated events. How often is it happening? Has anything changed? Are there other symptoms? What's your blood pressure reading? These questions matter much more than jumping to conclusions. And here's another fascinating discovery. Researchers now understand that many women delay cardiovascular evaluation because they attribute persistent symptoms to stress, menopause, aging, or the demands of daily life. Sometimes that's exactly what the symptoms are. Sometimes it isn't. The challenge is knowing the difference. Which brings us to another sign that's often misunderstood. Not pain, not dizziness, something far more subtle, and one that countless women dismiss every single day without realizing it could deserve a closer look. Number 2, unusual fatigue that doesn't seem to have a clear cause. Imagine Carol. She's 61. She sleeps 7 hours most nights. She eats reasonably well. Yet, by early afternoon, she feels completely drained. Not sleepy, not lazy, just exhausted. She tells herself, "I'm getting older." Her daughter says, "Mom, you do too much." Her friends blame menopause. And perhaps they're right. Fatigue has many possible causes. Everything from poor sleep and anemia to thyroid conditions, depression, chronic stress, infections, or simply a demanding schedule can leave someone feeling worn out. But researchers have also learned that persistent fatigue can sometimes appear alongside cardiovascular conditions, including high blood pressure, especially when the heart and blood vessels are working under increased strain over time or when other heart-related conditions are present. The important word here is sometimes. Fatigue by itself doesn't point to one diagnosis. Instead, healthcare professionals view it as part of a much larger picture. If ongoing fatigue is new, unexplained, or accompanied by other concerning symptoms, it's worth discussing with a qualified healthcare professional. Here's an interesting way to think about it. Imagine your cardiovascular system as a delivery service. Every day, oxygen and nutrients are transported to billions of cells throughout your body. When that system isn't functioning as efficiently as it should, some people notice they simply don't have the same energy they once did. Again, fatigue has many possible explanations, but ignoring persistent changes simply because they seem like normal aging can sometimes delay important conversations about overall health. And that's a theme you'll notice throughout today's documentary. Our bodies often whisper before they shout. But researchers discovered something surprising. Many women don't ignore symptoms because they don't care. They ignore them because they're experts at caring for everyone else first. And that brings us to another sign that's easy to dismiss. Number 3, shortness of breath during ordinary activities. Picture Maria. She has always enjoyed gardening. For years, climbing the small hill behind her backyard never required a second thought. Then, gradually, something changes. Halfway up the hill, she pauses. Not because she's out of shape, but because she needs a moment to catch her breath. It doesn't happen every day, only occasionally, so she assumes she's simply getting older. Shortness of breath has many potential causes: asthma, lung conditions, anxiety, reduced fitness, anemia, heart conditions, and sometimes temporary illnesses. Current medical research suggests that persistent or worsening shortness of breath deserves medical evaluation because it can be associated with a variety of cardiovascular or respiratory conditions. High blood pressure itself doesn't usually cause noticeable shortness of breath in its earlier stages. However, if elevated blood pressure contributes over many years to changes in how the heart functions, breathing may eventually be affected. This is why cardiovascular health is often described as a long-term story rather than a single moment. Think of your heart as a pump that's been working every second of every day since before you were born. More than 100,000 beats every day. Over 3 billion beats during an average lifetime. That's an incredible workload. The healthier the blood vessels remain, the easier that job becomes, which is why experts emphasize prevention, awareness, and routine health screenings. Not because symptoms always appear, but because sometimes they don't. Now, here's a symptom that surprises many women. It's one that often happens so gradually that people barely notice the change until someone else points it out. Number 4. Changes in vision. Susan sits down to read her favorite novel. The words seem a little blurry. She blinks, adjusts her glasses, looks away, looks back. Eventually, the page clears. She assumes she simply needs a stronger prescription, and often that's exactly the reason. As we age, vision naturally changes. But according to organizations like the NIH, consistently elevated blood pressure over many years can affect the tiny blood vessels throughout the body, including those in the eyes. The retina is filled with extremely delicate blood vessels. Because these vessels are so small, they can sometimes reflect changes happening elsewhere in the cardiovascular system. Researchers have long recognized that eye examinations occasionally reveal changes associated with long-standing high blood pressure. Most people won't notice these changes themselves. In fact, they're often discovered during routine eye exams. That's one reason regular comprehensive eye care becomes increasingly valuable as we grow older. It's not just about updating your glasses. It's another window into your overall health. Of course, blurry vision can have many explanations: dry eyes, aging, diabetes, migraines, eye disease, medication side effects. The point isn't to assume the worst. It's to recognize that persistent vision changes deserve professional evaluation rather than being ignored. But perhaps the biggest misconception about high blood pressure is this: many people are searching for dramatic warning signs. In reality, some of the most important clues are incredibly subtle, and the next one illustrates that perfectly. Number 5. Dizziness or lightheadedness. What does the evidence say? You've probably heard someone say, "I felt dizzy, so my blood pressure must have been high." But science paints a more complicated picture. Occasional dizziness has dozens of possible causes: standing up too quickly, dehydration, inner ear problems, certain medications, low blood sugar, anxiety, or even spending too much time in the summer heat. Clinical research suggests that dizziness is not a reliable symptom of routine high blood pressure by itself. However, dizziness should never be ignored if it is sudden, severe, persistent, or accompanied by other concerning symptoms. Healthcare professionals consider the entire clinical picture, not one symptom in isolation. Think about it like solving a mystery. One clue rarely tells the whole story, but several clues together begin to reveal a pattern. That's exactly how medicine often works. Blood pressure readings, medical history, physical examination, laboratory testing, lifestyle factors, family history, all of these pieces help create a much clearer picture than symptoms alone. And that's reassuring, because it reminds us that good healthcare isn't based on guessing, it's based on evidence.
Final, the biggest symptom may be no symptom at all. Imagine two neighbors. Both are 58 years old. Both enjoy walking every morning. Both feel healthy. Both have similar lifestyles. One schedules an annual wellness visit and has her blood pressure checked regularly. The other hasn't had it measured in several years because she feels perfectly fine. Looking at them, you couldn't tell the difference. Neither woman appears sick. Neither complains of pain. Neither has obvious warning signs. Yet it's entirely possible that one has consistently elevated blood pressure without realizing it. That's the challenge. According to the Centers for Disease Control and Prevention, CDC, and the National Institutes of Health, NIH, many people with high blood pressure have no noticeable symptoms, even when readings remain elevated over time. That's why experts don't recommend waiting until you feel like something is wrong before learning your numbers. Blood pressure is one of the few important health measurements that can change quietly. Unlike a broken bone, it doesn't usually announce itself with immediate pain. Unlike the flu, it doesn't necessarily come with a fever. Instead, it often develops gradually over many years. And that's precisely why regular screening has become such an important part of preventive healthcare. Knowledge, not fear, is the goal. But here's something many women find reassuring. Having one, or even several, of the symptoms we've discussed today does not automatically mean you have high blood pressure. There are many possible explanations for each of them. That's why context matters. And that's why healthcare professionals look at the whole person, not just one symptom. Myth versus fact. Let's clear up a few of the most common misconceptions. Myth number 1, I'll know if my blood pressure is high. Fact. Many people won't. Research consistently shows that high blood pressure often develops without noticeable symptoms. Feeling normal doesn't always reflect what's happening inside the arteries. Myth number 2, only older men need to worry about blood pressure. Fact, high blood pressure affects both women and men. In women, the risk increases with age, particularly after menopause, when natural hormonal changes may influence cardiovascular health. According to the American Heart Association and ACOG, heart disease remains one of the leading health concerns for women in the United States. Understanding blood pressure is one important part of protecting long-term heart health. Myth number 3, stress is the only reason blood pressure goes up. Fact, stress can temporarily raise blood pressure, and chronic stress may influence overall cardiovascular health. But it's rarely the whole story. Researchers have identified many factors that can contribute to high blood pressure over time, including age, family history, weight, physical activity, dietary patterns, sleep quality, certain medical conditions, pregnancy-related complications in some women, smoking, and excessive alcohol use. Usually, it's a combination of factors rather than one single cause. Myth number 4, if I don't have symptoms, I don't need to check my blood pressure. Fact, this may be the biggest myth of all. Routine blood pressure measurements remain one of the simplest ways to detect changes before complications develop. It's a small step that provides valuable information about your overall cardiovascular health. But researchers have uncovered another fascinating shift. The conversation around women's heart health is changing. And that's good news. Latest scientific understanding for many years, much of cardiovascular research focused primarily on men. Today, that picture is changing. Scientists now recognize that women can experience cardiovascular conditions differently, influenced by factors such as pregnancy history, menopause, autoimmune diseases, and hormonal changes throughout life. Organizations like the NIH, CDC, and American Heart Association continue to support research aimed at better understanding these differences. This growing body of evidence is helping healthcare professionals improve awareness, screening, and education specifically for women. Perhaps the most encouraging message is this: the more we learn, the more opportunities we have to recognize potential concerns earlier, not through fear, but through knowledge and regular preventive care. Heart health isn't just about reacting to illness. It's about understanding your body before problems arise. Before we finish, let's bring everything together. If there's one message to remember from today's documentary, it's this: high blood pressure often doesn't announce itself with dramatic warning signs. Sometimes there are no symptoms at all. When symptoms such as persistent headaches, unexplained fatigue, shortness of breath, vision changes, or dizziness do occur, they can have many different causes. Rather than trying to diagnose yourself based on one symptom, think in terms of patterns. Has something changed? Is it persistent? is it affecting your daily life? These are thoughtful questions to discuss with a qualified healthcare professional. Routine health checkups, including blood pressure measurements, remain one of the most effective ways to understand your cardiovascular health, especially because high blood pressure can develop quietly. Awareness isn't about expecting the worst. It's about giving yourself the best chance to stay informed. Think back to Susan from the beginning of our story. What changed her future wasn't a dramatic emergency. It wasn't a frightening symptom. It was a routine blood pressure check. That simple moment gave her information she didn't have before. And information creates opportunity. Opportunity to ask questions. Opportunity to learn. Opportunity to partner with her healthcare team in protecting her long-term health. That's what today's video has really been about. Not fear, awareness, not panic, preparation, not assuming something is wrong, but understanding that your health deserves attention even when life gets busy. Because every woman deserves to understand the incredible body she lives in. And every small step toward awareness is an investment in the years ahead. If you found this documentary helpful, consider sharing it with a mother, sister, friend, or someone you care about. You never know when one conversation can encourage someone to learn more about their health. And if you'd like more evidence-based videos that explain women's health in a clear and easy-to-understand way, subscribe to the channel and join us for future documentaries. Our goal is simple: to help you understand your body with confidence, one topic at a time. Before we end, it's important to remember that everything discussed in this video is intended for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. The scientific information presented reflects current evidence from trusted organizations and peer-reviewed research available at the time this video was produced. Medical knowledge continues to evolve, and recommendations may change as new evidence emerges. If you have persistent symptoms, concerns about your blood pressure, or questions about your cardiovascular health, discuss them with a qualified healthcare professional who can evaluate your individual situation. Thank you for watching, and until next time, take care of yourself, because understanding your health is one of the most empowering steps you can take.